still smell that moxa. It smells amazing. Not everyone likes it. Are you okay with it?
Yeah, I'm used to it, I think.
Yeah. Right, I'm going to get my hands all the way as far as I can. Yeah, they're past the scapula and they're either side of the vertebra, the spine, and I'm just shifting, I'm having a feel and a check, just shifting each vertebra left and right. Let go, let go, let go, to see if it goes, to see if it's malleable, palpable, movable. Yeah, much better than it was. Especially, this is T1 here, this knobbly bone just at the very base of the neck. That's probably the tightest of all of them now, but the others aren't too bad. Those ones I was working on earlier, the T2, 3, 4. Okay, working into the neck. What do we find today? We've got a nice long neck here. And relax. So you can see I've got my fingers in a row at the very base of the occiput. In fact, underneath it. Just circling, wrapping underneath it. And I'm encouraging Jez to relax, tilt his head backwards, almost as if he's looking at the back wall, which is where our head should go once supported at the base of the occiput. Relax, relax, relax. Now a stretch. And all the time I'm working like this, I'm looking down the spine, checking the alignment, the ribs, the pelvis, the knees, ankles, the toes, the feet, that everything is aligned. If anything isn't, it's not a problem, it just means that it's something else I need to be working on. I see it as my mission to get the body aligned. It's not a problem with the person's body. It's something that I need to be doing. Having said that, every person that comes to see me, I treat as a dual mission. It's between us, so it's their responsibility as well to do some homework between treatments. So one biggie is that I often ask people, especially first day or two after a core therapy treatment, to avoid doing asymmetrical jobs. So for instance, hoovering, sweeping, mopping, brushing, raking, all of these things that tend to be repetitive, one-sided action, and that can include sports like badminton and tennis, golf for instance. So anything that's one-sided is not great to do after a core therapy. So I'll ask people to have a little bit of homework, avoid those things for a day or two, or if they need to do hoovering, etc., to alternate which arm and hand uses the instrument so that they use their body symmetrically. Turning the head, having a look at the neck now, working down the neck, seeing if there's mobility within each of the top vertebra. And then working in the processes. So the spinal processes are the arms of each vertebra as it stretches out left and right. And I'm just feeling at the moment, with a little pressure, to tilt it to see if it will rock away. And these are not bad at all, considering Jez has a nice tall back, long spine, long neck, and it has had neck issues in the past. How 99% of us have. But this is feeling not too bad today. Nice and soft. Mind you, he has been lying on the couch for about an hour and a half now, having a lot of treatment, all different kinds of things that I've been showing you, and I'll show you in a few videos on here. So not bad after all of those different techniques. Relax over to your left and working down the opposite side. Okay, so now working on the opposite side. I like to push the clavicle down as well so that I've got a nice long neck. I can see what I'm working with. Hopefully there's some give in the clavicle, in the neck bones. Great, and now just feeling this side. And it's interesting how one side of the neck can feel so different from the other side. Doesn't feel like the same person sometimes. But actually, this one feels great. Nice and loose, soft, malleable. Fantastic. I mean, the fact that these vertebrae are giving under my thumb is a great sign. And now I'm pushing the processes, the spinal processes, to see if those arms are able to tilt over to the right side, and they will. That's a good one there. Is that sore or is that okay, Jez? Yeah, a little bit sore. So I can normally tell when there is something out of alignment. That one just slightly, just feels like it's blocked slightly. There's a little bit of extra tension there, but it's going as I'm pressing there. I'm not giving too much pressure, it's just contact, it's just anchoring really. Always reassuring the client, letting them know everything's okay, you can let go, I know what I'm doing. Really good, fantastic. So I'm just going to hold the head now and work a little bit with the head levitated. I've got the full weight of the head. Jez is completely given the weight of the head and neck to me. Just going to tilt again, letting it rock back. You can see he's tilting all the way back as if he's looking at the back wall. I've got my fingers in a row underneath the occiput at the top of above C1, and now a nice gentle pull. Fantastic. You see, by doing a neck release like this, it helps so many things, and that includes clarity, clear-headedness, sleep. It helps avoid headaches, prevent headaches and migraines, because it allows free blood flow and good nerve signals to work at their optimum. Wonderful. So now I'm going to put my fingers in a row this time, instead of underneath the occiput, just under C2. That's another good one, and you'll notice the head is tilting even further back the further down the neck I go. Just holding it for another little while. And the good thing is, at the moment you can see that I'm not wearing any PPE, mask, gloves, visor, how I have done in the past. Jez hasn't got a mask on either, and that's because obviously we're in the same household. But at the moment in the UK, I am having to wear a mask for every client, and all clients are having to wear masks as well, unless they're exempt. Nice pull there. So I'm stretching the neck as well, which gives the head, once left again, a feeling of weightlessness. Now pushing the shoulders down, so I'm working from both angles really, pushing the shoulders down, especially at the very base of the neck and across the trapezius, and then pulling the head, but just gently. I don't want to tug the skin too much, and especially ladies with long hair, it'd be very easy at this point to by accident pull the hair. But I'm just wanting to give that stretch without any pain. Fantastic. So now I'm going to do another shoulder stretch by holding the base of the occiput with one hand and then pushing with the other hand down on that shoulder. I'm having to anchor myself with my foot against the wall while I do this, otherwise I'll just spin across the room. It's a nice strong stretch. Now muscles will hold on for 22 seconds, so if the therapist, in this case, this is a good one to try, can stretch for at least 20 seconds, that will really help that neck, shoulder and arm let go. Fantastic. Coming round to the other side, supporting the occiput and stretching down. That feel all right, Jez? Is it too much?
No, it's okay.
Okay. It's amazing how much pressure you can apply here, actually. Holding for a good few seconds. Noticing that the feeling of stretch gets less and less as the seconds go on, because it's giving in. Beautiful. Okay, so bringing the head back. Nice bounce. Now that is a really good sign. So when I bounce that down, the shoulder comes back up again. Same with the other one. Now some people that are very stiff and tight, I'll bounce that down and it will stay there. It won't come back up. That means that the muscle across here that's holding that shoulder is completely static and tight, and there is no give in it. So it's my job to get that malleable working and soft again. Wonderful. So I'm just going to do a little bit of a neck and temporal QiGong healing release, just for a moment, to anchor the whole treatment that we've just given into the body, into the spine, the nerves, into the blood system, into the cerebral spinal fluid, where I was working just a few minutes ago at the sacrum. And I know that Jez is completely relaxed and switched off again, because when he relaxes deeply, just like a lot of my other clients, the body starts to make little tiny, almost imperceptible movements. with my thumbs at the temporal bone and my other fingers stretching around the back of the occiput and the top of the neck. I'm marrying up the energy from where I've been to where I'm finishing. I'm hardly touching at all. There's certainly no pressure. It's just a little contact at the sides of the temporals. It's a beautiful energy. It doesn't matter if clients fall asleep. In fact, it's a real compliment to the therapist. Their body can take on the healing, the repatterning so openly. Oh, that's a good sign. It's all good. Okay. Okay, so we're just finishing off the core therapy by retesting a few of the kinesiology muscle tests that failed at the very start. So I can remember it was your right side IPSI, so that's your right arm and right leg. Yeah, I'm going to push and hold. Rock solid. And it was this contralateral and hold. Wonderful. And this one and hold. And I'm really pushing and there's no movement. It's fantastic. So that was good because the right side IPSI was where I felt behind the right hip. Both contralaterals meant that it was the jaw, and I gave the TMJ release earlier, so that seems to have worked. Now the other one I want to check are the hips. So I'm just going to push down with one. Can you raise a leg for me and hold? Wonderful. And the left side, sorry, and hold. Yeah, just going to try tilting them, holding that for a few seconds, and hold. Great. Other way round, and hold. Wonderful. Okay, so the one where we see if it's intact did pass earlier, so that's great. So we're done. Would you like to sit up? And how do you feel?
I feel great. I think that's as strong as I've felt in the core for quite a while, actually.
Strong as in you're passing your tests and you felt...
Passing the tests, yeah, definitely.
Yeah, so you feel like your body is aligned and strong and you don't have any particular weakness.
No, not at the moment.
At the moment, yeah. I mean, a couple of things came up, but I was able to, or the core therapy was able to rectify those quite easily, which is nice to know. Good old core therapy.
And I really enjoyed the tweener.
Yeah?
As ever.
Yeah.
That is amazing. And
Yeah.
the wing stretch as well today.
Yeah.
Feels like it's doing something good for the body.
Yeah. Well, the wing stretch is working on the upper body, the thoracics, the scapula, and that's why I used the wing stretch, because I could feel that tightness in about T234. But of course, you do a lot of cycling and you're down on the handlebars like this, and just imagine the pressure on your upper body when you're like that, with your neck at an angle like this. So that's what I'm always thinking about, your body lifestyle and what it's got to cope with and what I might have to rectify in treatments.
But no, feel great.
Good. And everyone wanted to see you again, Jez, so here he is.
Great. Here I am. Good to see you all too.
Oh, it's nice. You see, he's more talkative today. No, it's been great to work on you today, and I'm glad it's helped.
Thank you.
Okay, bye guys.
Cheers. Bye-bye.